Have you ever looked in the mirror and been unhappy with how you looked? When I was 8, I would look into the mirror and hate how short I was. It made me believe I wasn't good enough or strong enough. So, to compensate for this, I took martial arts, earning my black belt at 15. I then got into weightlifting, which I grew to love. I realized these were ways of becoming stronger and staying in shape. For years to come, I believed by working out and eating well, nothing could go wrong with my health. But I was wrong. In November 2018, I was diagnosed with an autoimmune disease called ulcerative colitis. Ulcerative colitis is a form of inflammatory bowel disease, or IBD, in which the immune system attacks the large intestine. Symptoms can include bloody diarrhea, stabbing stomach pains, an immediate urgency to use the bathroom, loss of appetite, and weight loss, all which I experienced. And it was the last thing I wanted to hear starting my young adult life at 22. Various doctors told me I looked healthy, that I didn't need surgery, that I was going to be fine. But by May 2019, my colon was so inflamed, I was going to the bathroom up to 24 times a day. I went from being 145 pounds when I was initially diagnosed to 101 pounds. The disease made me dwindle, physically and mentally, to the point where I could no longer live a normal life. My clothes no longer fit me, and any amount of food I tried to eat to gain weight went right through me. My hair became so paper thin, it started to fall out. Sometimes, after using the bathroom, I would stare into the mirror, trying to recognize the 22-year-old who had just graduated from college. In those moments, all I can see was the shriveled up 23-year-old man who in less than a year had become nothing but skin and bone. In September, after a summer of hell, my doctor advised me to have an emergency surgery to have my colon removed and to live with an ileostomy. An ileostomy is where the end of the small bowel is brought through an opening within your abdomen. That opening is called a stoma. Around the stoma goes a bag in which holds your stool, called an ileostomy bag. When I heard I had to live with an ileostomy, I broke down and cried. I did not want to have my colon removed. I believed people would treat me differently, and I thought I would never be in a romantic relationship ever again. My only other option was to go on an autoimmune medication that would severely weaken my immune system. And I was told some patients did not survive that route. But then, my surgeon presented me with another option, a J-pouch. A J-pouch is where the surgeon shapes the small intestine into a J, allowing me to use the bathroom without an ileostomy or colon. It was a 3-part surgery. First, I would have my colon removed and live with an ileostomy temporarily. Then after another 3 months, I would have the J-pouch surgery and continue to live with an ileostomy until I healed. Then after another 3 months, I would have the stoma reversed. The day before I had my colon removed, I felt angry and distraught. Why is this happening to me? What did I do to cause this? Then, one of the residents told me, "We're here to save lives, not colons." Although my life was being saved, it felt over. Until Andrew came in. Andrew was my ostomy nurse. I knew there was something about him when he came into my room and lit it up with a bright smile. Andrew described to me his previous patients who were as sick as me about to have their colons removed. He told me how much they improved, how the color came back to their faces because of the ostomy. He reassured me with hope, saying I would gain weight and be free to live my life again. Andrew taught me how to live with the ileostomy and how to change the bag step by step. He encouraged me along the way, saying how he wasn't worried and knowing that I'll get it down. Andrew viewed ostomies with such incredible positivity, such as calling the one I wore a Gucci bag, or telling me that patients name their ostomies. So I called mine Alejandro. When I was about to leave the hospital on a Tuesday, Andrew told me something that I will never forget. He said, I love ostomies. I want patients to master them so they can live their lives again. In that moment, I became proud to live with an ostomy. He not only changed my whole perspective on ostomies, but my whole perspective on life. I then asked him, do you think it would be okay if I were to go to Hoboken this weekend to my friend's housewarming party like this? To which he said, you go to Boken. If you feel good, you're going to have a fun night. That's exactly what I did. I went to that party, weighing 113 pounds, feeling more confident than ever. Throughout the next 2 months, I started to do all the things that I couldn't do before. I gained weight. I expanded my diet. I worked out again. I no longer looked in the mirror, hating my body, because my ostomy freed me. I learned to gain this new, grateful, and confident perspective on life that made me appreciate all the little things it had to offer because of Andrew and Alejandro. In November 2019, I had a follow-up appointment with my surgeon to discuss the J-pouch surgery. He told me I was to get a new type of ileostomy bag. I asked him if Andrew could teach me how to use the new bag. He said nothing, and then brought in the department's head ostomy nurse. And that's when she put her hands on my knees and said, I am so sorry I have to be the one to tell you this, but Andrew passed away. I went into shock. She told my mom and I he passed away from a medical condition at 27 years old. Then all the thoughts started to roll through my head. He'll never see me healthy and confident. He'll never know the impact he made on my life. He'll never hear me say the words, thank you for changing my life. After my next 2 surgeries and having my stoma reversed, I had many complications afterwards. Frequent vomiting, kidney stones, urgency, loss of appetite, weight loss, made life unbearable to live again. That's when I decided to research a new doctor and found a surgeon at NYU Langone whose specialty was redoing J-pouches. My surgeon advised me that I had to redo every surgery I went through, including living with an ileostomy temporarily again. But I didn't mind this at all. In fact, I was excited to have the ileostomy again because of Andrew's guidance. NYU's team and my surgeon helped me immensely with their compassionate care, encouragement, and support at every step of the way. Throughout the next 2 years, I redid every surgery that I went through. And on March 29th, 2022, I finally closed the door to the 4 years of shit. And opened a new one to the best years of living my life to the fullest on a biological drug in remission. Ever since Andrew's death, he became my inspiration to spread awareness of IBD. His afterglow lives on and not only motivates me, but others to put our health first and to live with the perspective on life he taught me. Look into the mirror. Love, be proud, and embrace your body, your ostomy, your height, your weight, your hair, your scars. And that doctors are here to save lives, not colons. And I know if I were ever to have an ostomy ever again, I know I'll be okay because I'm going to live life the way I always will, the way Andrew taught me to, with a Gucci bag. Thank you.